You will agree with me that for many households in Nigeria, mosquitoes and its effects of malaria has become an all year round menace, which continues to defy all remedies FCT residents have to contend with. What has been described as a seasonal spread of malaria disease, with many families having one or more suffering from the ailments. Our guest on Saturday Discourse, Pascal Ogu of the FCT Public Health Department, will be here live in the studio to speak on this and other issues. Hello, I am Abdullah Hajia. Thank you for joining us on yet another episode of Saturday Discourse. We'll be right back shortly. Let's start with the stories. In a bid to help women to strengthen businesses, the First Lady, Oluremi Tinubu, has disbursed 65 million naira in grants to empower more than 1,000 women petty traders in the Federal Capital Territory. Howard Gimba reports that the FCT Women Affairs Mandate Secretary, Adedayo Benjamin Slani, reiterated that the grant is to help women overcome the challenges faced in their businesses.
The grants, tagged Recapitalization under the Renewed Hope Initiative Economic Empowerment Program, is aimed at creating opportunities for women petty traders in the FCT and the 36 states of the Federation. Representative of Nigeria's First Lady and coordinator of FCT Renewed Hope Initiative, who is also the FCT Women Affairs Mandate Secretary, Adedayo Benjamin Lani, discloses that a total of 1.85 billion naira is being disbursed to more than 1,000 FCT petty traders. The reason, she further explains, is the most core objective of the Renewed Hope Initiative, which is being delivered to both women and youths across the 6 geopolitical zones of the Federation.
We are all aware of the challenges faced by small and medium enterprises, especially our petty traders, who form the backbone of our local economies. These challenges, however, have not deterred the strength of our women. I salute you all and celebrate your courage.
The Renewed Hope Initiative of the First Lady of the Federal Republic of Nigeria has come to stay as an interventionist initiative that has given hope to Nigerian women, children, the youth, and all other demographic representation, including people that are living with disabilities.
Earlier, the FCT Minister of State, Dr. Maria Mahmood, describes the program as a giant stride towards empowering women entrepreneurs and enhancing their economic resilience. Also represented FCT Coordinator Social Investment Program, Ajia Mejida Musa, commends the First Lady for her commitment and dedication to putting smiles on the faces of women, youths, and the vulnerable in the society.
Excellency, your investment in human capital through the Renewed Hope Initiative in the area of economic empowerment, education, health, social investment, and agriculture have been invaluable.
Our mama here has been trying, and our own mother, Her Excellency, Honorable Tinubu.
As the saying goes, investing in Nigerian women's growth, the government is creating opportunities for a better future. Hawagimba, NTA News.
Now, about 5,000 FCT residents across the 6 area councils are benefiting from a free medical outreach. This demanded Secretary for Health Services and Environment, Secretariat Adedolakbo Fashewe says is in line with the Renewed Hope initiative of President Bola Tinubu. Shaubali reports.
Report of World Health Organization says over 2/3 of Nigerians do not have access to eye care services, and it has become imperative for stakeholders to improve the health system at primary eye care level in order to deliver the World Health Organization's primary eye care package. To this end, the Health Services and Environment Secretariat of the FCTA and the Atom Foundation are collaborating to reach out to FCT residents with eye care through this medical outreach, which includes cataract and glaucoma operations, free medical glasses, as well as eye drops.
Government can't do it all. We also need the support of organizations like this to support, provide care and access to healthcare for our citizens.
So I'm very excited. I'm the minister of FCT and state minister. I'm very happy with them, and I'm happy that the turnout is come. And this is the only way that the masses can have opportunity to come ahead.
Some of the beneficiaries applauded the program and called on other groups to support government initiative, especially in healthcare delivery.
Na samu shekara uku ina fama da wannan larura. Kuma amma yanzu kuma an man aiki kyauta, Allah ya saka da alkhairi.
Just for reading, but I don't use it for anything else. I can see very far, I can drive without glasses, but it's just to read.
Out there, surgery is going on. Cataract surgery takes between 15 to 20 minutes, depending on the complexity.
According to the founder, Yahaya Guja, the initiative will be sustained. Aisha Ubaali, NTA News.
Still talking health, August 20 attracts global attention towards highlighting the tiny terrors that threaten millions of humans with deadly diseases every year. This is with the observance of 2024 World Mosquito Day, an opportunity to spread awareness and protect communities from these dangerous insects. Here is Akimet Aliyu with more on this.
1897, Ronald Ross, a British doctor, made the discovery linking malaria to mosquitoes. It is in recognition of this that the World Mosquito Day was established to raise awareness about the threat of mosquitoes and public health due to its ability to spread numerous diseases among humans.
Mosquitoes are a major threat to human health, and they cause malaria basically in Nigeria, and they can also cause yellow fever as well.
Scientists have, however, continued to work on tools to control mosquito-borne diseases and sustainably reduce the numbers of mosquito vectors or their ability to transmit diseases.
The use of gene drive and genetic engineering in mosquito control is going to be one of the ways of managing malaria and other diseases resulting from mosquitoes.
Despite the use of numerous insecticides and other means to rid the environment of the insects, it is no news that over time, mosquitoes have shown resistance to many. Dr. Raliat Aliu is an entomologist who specialized on mosquito susceptibility to insecticide.
I collected mosquito samples, mosquito larvae from different habitats from the Federal Capital Territory and reared them in the lab. When they were matured, I exposed them to insecticide paper. After exposing them to insecticide paper, I was able to separate those that were resistant that after 24 hours exposure. So they were now collected, and I now took them for molecular analysis. I extracted the DNA, run a PCR on them, and checked those species of mosquito that had the knockdown resistant gene.
In Nigeria, as a way of commemorating the World Mosquito Day 2024, the Nigeria and NTD's Youth Corps was launched to strengthen the country's ongoing effort to eliminate malaria and other neglected tropical diseases.
Through the Zero Malaria Starts With Me campaign and effort towards universal health coverage, these champions and volunteer force will lead community-based initiatives that drive behavioral change and policy support.
The theme for this year is Be Covered, Stay Safe. In Abuja, Hakimat Aliu, NTA News.
Well said, Akimet, and that will stir our discussion with my guest. And join me as I welcome Pascal Ugu, the Health Promotion Officer, Public Health Department of the FCT Administration, who will be joining us to discuss more on this topic, talking about mosquito and malaria. You're welcome to Saturday Discourse.
Thank you so much.
Well, you're an expert in this field, and I want to start my discussion and question by asking, is mosquito always synonymous with malaria?
Okay, good evening, listeners. My name is Pascal Ugu from FCT Public Health Department. So I can imagine that there is no malaria without mosquito. You understand? Because it is this mosquito that carry the causative organism that causes malaria. So especially in this season, when you discover that you find these mosquitoes everywhere, irrespective of how you be careful, closing your window, using door nets, window nets to protect yourself, but you still find them inside your house. So I would say that a mosquito-free environment is a malaria-free environment.
That's fantastic. Okay,
Yes.
well, I know efforts have been on from individuals, organizations, governments to find a way of containing, this malaria, scourge. Now, let's talk about how effective is a seasonal malaria chemo prevention, that is SMC, in reducing malaria transmission.
Okay. So SMC, which stands for Seasonal Malaria Chemo Prevention, is an intervention that came up as a need to curb the effect of this malaria, especially in children. We all know our body system, how we react to malaria. Then you can imagine how a kid, an infant, let's say, because this program is for children 3 months to 59 months, that's 3 to 5 years. So as an adult, you feel weak, you feel your body is disorganized when you have malaria. You can imagine how these children will feel. So it's an intervention that came up as a need to arrest this mortality being caused by malaria in these children. So SMC, which I said earlier on as seasonal malaria chemo prevention, is the administration of malaria preventive drugs to these children, eligible children, 3 to 59 months. What this preventive medicine does is that it helps to build the immunity of these children. Now, as I said, it's seasonal. It comes only during the peak of rainy season. So the target is the children. And you discover that when you give it to these children and their immunity is equipped, when this malaria comes, the rate of mortality will be reduced in these children.
Okay, well, I know most of health programs come with, a time frame. Is this SMC timed, or is just on till we're able to conquer malaria or mosquito in Nigeria?
Okay, so thank you for that question. SMC, as I said, is seasonal. It comes at the peak of rainy season. We all know that we have season, we have dry season, we have harmattan, we have rainy. Rainy season starts late February and March. So this SMC starts from that peak of rainy season. You discover that when the rain starts, it's not that serious compared to around May, June, July, and all those. So this SMC starts at the peak of this rainy season. And in FCT here, the program for this year started June. And presently, we are on the 3rd cycle. The first cycle started by June, second cycle, July, then this August is the 3rd cycle.
Okay, well, I know the implementation, like you say, is ongoing. What would you say are some of the challenges being encountered in the implementation of this SMC?
Okay, so I know every program comes with its own challenges. So you discover that the people you are dealing with, they have different beliefs, like these mothers, especially in the rural community. So sometimes when you approach a mother and you discover that the mother says, I've not heard anything about SMC, it becomes an issue because that mother will not allow his or her child to take that drug. And you discover that when you miss one child, the efficacy of that program has been affected. So the program encountered is over the years is lack of awareness. Most mothers are not aware of it. That's why we've been going around the community, radio station, media houses to educate these mothers the importance of this SMC and the role it plays in the life of their children. And over the years, recently, when this awareness has been heightened, we have recorded progress and we recorded good number of people that have complied to taking these drugs.
Okay, now, well, I know this kind of program, when you streamline it and it's more effective at the hospitals where people access clinics or a maternity center. What about those remote rural communities? Do you take this program to them?
Okay, so this SMC in FCT now, previously we used to have fixed posts in health centers and in hospitals, but for this year, there is no fixed post. So there are community drug distributors that go to the remote part of the village to make sure that each child is captured. Now, it is now the work of this group, this team of health workers to go. This team of health workers are selected from each area council and each community. They are people that know the nook and cranny, where to find children, where not to go and where to go. It's called that when these people are employed, they are trained on how to go about this, and they take the drugs directly to households. Yes. Okay. So for this season, there is no fixed post in hospitals or health center.
So where do we now place this school of thought that believes that mosquitoes are becoming too resistant to some of the drugs that have been in place to help cure this malaria? What is the efficacy of this SMC in terms of the resistance of some of these mosquito to these drugs?
Okay, so this program was initiated in 2012 by the World Health Organization after much trials. Before a program is being initiated, there must be tests that have been carried out to show that such program is very, very, very effective. So over the years, in some states, it started in the northern states of Nigeria, and presently it started in FCT 3 years ago. This is the third year in FCT. And over the years, in other states that this program has been ongoing, we've recorded a high level of changes. Do you understand? So these children in these states their body have become very, very immune to, the mortality rate have greatly reduced, which goes to show that this program is very, very effective.
I must thank you very sincerely, Pascal Ogo, health expert and also health promotion officer with the FCT Public Health Department, for coming on Saturday Discourse. And we do hope that you also come up with something that adults to be taking, not only children, because adults are seriously battling malaria on a daily basis.
So yes, for adults, the immunity, as you grow up, the immunity becomes stronger.
Okay.
So compared to these children, but adult, this drug is targeted to these children. Maybe along the line, the one for adults, maybe it will reach the adults, but for now, it's for children 3 months to 59 months.
Thank you for coming on Saturday Discourse.
Thank you so much.
All right, the news continues, but this is after this time out. Do stay with us.
Ambition.
My G, for our ambition, we go hard.
We go day night till we make it.
We go hard till we find that perfect beat.
The perfect beat, the one the world will put on repeat.
So we chase greatness in every moment, making every naira count.
We put out content after content till it's comment after comment. And with Glow by our side,
we have more to offer.
Because the MyG bundle comes with bonuses, giving you way more data value and way more steez on IG, Snapchat, TikTok, WhatsApp, Glow TV, Audio Mac, and Boomplay in one fly package. Dial *312# now and select MyG bundle.
Glow Unlimited.
Thank you for staying tuned. Emergencies are unplanned, natural or man-made disasters occur. leading to an emergency. FCT, like other cities within and outside Nigeria, have situations calling for emergency management agencies towards disaster control or crowd management. Correspondent Ifoma Ojinta takes a look at the peculiar situation here in the FCT.
Crowd control involves managing people in a way that keeps them safer, away from specific activities, equipment, and better organized. It can vary in application. It helps evacuate a building safely, keep people away from specific manufacturing equipment, or ensure orderly operations. Overall, crowd control keeps things from getting dangerous, costly, or disorderly. During emergency situations in the Federal Capital Territory, how have disaster managers been able to manage the crowd and ensure safety of both the victims and the crowd? Have they been able to live up to their responsibilities?
Being the coordinating agency, we have built the capacity of our response team. They can respond to accidents, building collapse, flooding, when people are washed away, when people get drowned. There are times that somebody may fall into a well, in a confined place, not just a well, there may be a ditch. We swing into action. If it is fire outbreak, we have built the capacity of our rescue team.
Findings reveal that disaster managers may need to set up crowd control measures to secure the perimeter of the facility during an emergency by cordoning it. This allows them to keep employees a safe distance away and onlookers out as emergency operation takes place.
The challenge we have now is with scavengers, especially when there is a building collapse. They rush in there, not minding what will happen to them. They don't know if another part of the structure is going to collapse again. They rush in there and begin to pull the iron rods. All the reinforcement there, they begin to struggle to see how they will cater away with it. So it's a challenge, but it can never be overwhelming.
Experts say in a serious emergency where an evacuation is necessary, crowd control measures keep order in chaos. Everyone knows where to go and what to do to evacuate the facility in an orderly fashion. Better organization during an evacuation prevents injury as people leave and ensure emergency personnel can assess the injured and the fire or hazmat incident itself. Ifoma Ojinta, NTA News.
Up next is Sports Brief from our Sports Desk.
Super Eagles coach Garnet Raw is set to announce his squad for the upcoming African Cup of Nations qualifier against Benin Republic as the team seeks revenge for their previous loss in the 2026 World Cup qualifier. Since his appointment, Raw has stabilized the team and is aiming for a return to the biennial competition. The Super Eagles will host Benin Republic on September 7th at the Godswill Akpabio Stadium in Uyo. In other news, former coach Jose Pizarro has praised Ademola Lookman as technically better than Victor Osimhen, citing his impressive performance this year. Additionally, defender Leon Balogun has fully recovered from his injury and is set to return to action for Rangers, who are seeking their third consecutive win against Ross County. With Sports Brief, Wayne Dogo, NTA News.
Thank you, Wayne. And of course, a couple of matches have been played in the English Premier League with very good results, including that of Tottenham scoring 4 goals to nothing, and Man City also beating Ipswich Town by 4 goals also. Well, Arsenal and Aston Villa are still on. On that note, we come to the end of Saturday Discourse for today. Do join us next week for another package. I am Abdullah Hajia. Good night.